because this subject is very close to my heart. You know, menopause affects every woman, but it is still wrapped in silence. I remember once one 50 years lady, she came to me and whispered in my ears, saying that she has got heart pressure sign, uneasiness. She's afraid her mental imbalance has gone. All she needed was clarity, assurance. Yes, some symptom relief also. In our Indian culture, women of 40, 50 is like an invisible backbone, caring for children, parents, and grandchildren. Should we not care for her health? The same, you know, each wrinkle carries a story and each gray strand an experience.
Slides are not moving.
No, I haven't yet moved.
Okay.
For many, aging begins with the unknown fear. And as healthcare workers, we have to empower them with vitality and dignity. Getting old is mandatory, but feeling old is it is optional. Aging, what a misunderstood word it is. Often we feel their story has ended there when we say it is old. No, it is starting of the next chapter. To age gracefully doesn't mean looking young, taking ownership of your body, choices, and your joy, and never apologize for growing old, celebrate it in I think. So, to define aging gracefully, it is about embracing the physical, mental, and social changes that come with age while maintain a positive attitude and a fulfilling life. It isn't just looking younger, but about cultivating inner strength, wisdom, and overall well being. It is about living fully, wisely, and vibrantly at every age. As an Indian woman, you are not just growing older, you are becoming more you. It's my mother. It's about accepting the natural process of aging rather than fighting against it, focusing on maintaining health and happiness throughout life. At the age of 80 years, she was so fit, even at 94, when she had fracture of femur. That time also, with the same vigor, she was carrying. Once the Modi was telling everybody Tridanga. So she posed for this and then she gave the thing. What it means that is gracefully, feeling of joy and uplifting. Whatever it is, it makes us admire them at this age. Whoever it is, if they carry like this. Uh, Madam, without your permission, I have taken your photo because they are all beautiful older women who doesn't seem to be going out of their way to hold on to their youth. Wrinkles, gray hair happen with everybody. Many a time, problem is accepting the fact. Goal of aging gracefully be
Your
happy,
slides are not
healthy.
visible.
Are you able to see my slides? No,
No, ma'am.
no,
Your slides have gone, ma'am.
I'm
You have
not
to
able
share
to
them
hear.
again.
Share.
What happened?
We could see them earlier, but only they have disappeared.
Now are you able to see?
No, ma'am.
No. Yeah.
दोबारा से लगा लीजिए और स्लाइड चेंज कर लीजिएगा.
Okay, what happened? I don't know. Shall I go back now? Yeah, minimized. Shall I start again? Shall I share?
Yes, ma'am.
Yes.
Share again, ma'am.
Yeah, I am doing.
Yes,
Yeah.
it is there.
Are
It's
you able
there.
to see now?
Yes,
Yeah,
yes.
Yeah. Sharda madam is here. Madam Sharda Jain, without your permission, I have taken your photo because you are all beautiful and who don't seem to be going out of their way to hold on to their youth. Wrinkles, gray hair happens with everybody. Many a times problem is there in the accepting her.
मैडम को डॉक्टर शारदा जैन की फोटो आती ही चली जाती है, वो क्या जब तक नहीं आऊंगी आगे नहीं बढ़ना।
मैडम अभी देख रहे हैं, अभी है क्या मैडम गोल ऑफ, आप देख रहे हैं मैडम?
Madam, your slides have vanished again. You will have to share again.
ओके, आई डोंट नो व्हाई.
I think some internet connection should be गड़बड़ हो रहा है
No,
शायद.
मेरा connection is good, but anyhow I will share again.
We'll try once more. Never mind.
I'm very sorry for the Are you able to see now?
No, ma'am.
Hello?
No, ma'am.
No.
No,
Hello?
no, not yet.
Now? Are you able to see now?
No, ma'am.
नहीं, ma'am.
No. Oh, shall I send this PPT to you, somebody?
Send it to Malti,
To
ma'am.
Renu?
Yes, madam. So,
Ma'am, send it to Malti. Ma'am, send it to Malti.
I am so sorry. Please wait. I'll send the presentation to Malti. Okay. Wrong. I'm going back. Wait for 5 minutes. I will give the. These things are.
Renu ma'am is not here anymore. Should we?
Hello?
Yes, ma'am.
Yes,
we can
ma'am.
see.
Shall I
Yes.
proceed? Yeah.
Yes,
There are
ma'am.
certain rules of graceful aging. The strong social support, family network, friends and colleagues, like all of us. Exercise program, as we do every Sunday in our IMS program, we have an exercise program. Take charge of your brain. Make an active commitment to learning and growth. Take charge of financial future. Plan, and plan. They're very, very essential at this age. Nutrition, remain goal oriented and make friends with youngsters. Remain active till your last breath. These are the things which we have to follow. I'll a little share all these things. So we have different types of women in India: working, non-working, urban, rural, and it all depends on what is their social background, how they come and. Hello.
Yes, ma'am. We can hear you. Kindly,
Yeah,
everybody
we
else.
have
Kindly.
about 32.8. Hello, are you able to see, madam?
Yes, yes, ma'am, we
Yes,
can
hello.
see.
Yes, yes.
And we can hear you very well.
32.8% of the women are working, and the population of women working has increased since about 2 decades. And still, agriculture people who is working in farms is about 55%. And we have people working in healthcare, IT, banking. It means everybody has got different type of problems, but all is together, but still what we have to face. Striking the right balance is the key. Stress is a major problem because as Indian women, we do so many things at a time. Morning means two hands are not enough for us. Packing the food, getting ready, people, this thing, that thing, so many things, but still we have to accept the truth that aging will come and we have to accept it. I'll just give an example. A 52 years old homemaker with heart pressure, joint pains, weight gain, and her BMI is 32. She's depressed, lonely because husband is in a very high position where he goes for camp every day and nobody is there. Children are abroad and she's alone and scared of taking any hormones. Wants to know whether there are any alternatives. So the first and foremost thing is counseling, and counseling. So first step towards health and happiness is she should decide by herself. Aging means you are going to be aged, but aged gracefully, and you should know what is most important to you. What brings you joy? What adds value to your life? How do you want to age? You have to set goals by yourself. And you know, up to the age of reproductive period, we are all very gay and enjoying because of the hormone estrogen that is there. But from perimenopause, it starts falling. But all the problems will not come together. In the perimenopause itself, the problems of heart pressures and forgetfulness, loss of memory, so many things will start. If we'll go to one room to bring something and we'll forget about it, and again we'll come back, we'll run for doing milk. If we keep it on the stove, we forget and it will get spoiled. Like so many problems, we feel that we have become mad. But they're all temporary. They all will disappear. The real problem comes for a long-term problems of the menopause, that is osteoporosis, dementia, or diabetes, hypertension, heart disease. These are the problems which we have to tackle. How do we do it? So, my general advice to everybody, all the women, and ordinary women, of course, we are all educated doctors, we know ourselves how to behave. For an ordinary woman, I advise is accept and celebrate yourself. Aging is not loss of youth, but a gain in wisdom, experience, and self awareness. Don't chase your 20s, cherish your 50s. Each wrinkle has a story. Learn to smile at the mirror. बुढ़ेपा का मतलब कमजोर नहीं है, समझदार और सुंदर बन जाना है. Prioritize your health first. No one else will will do it for you. You will do it yourself. What is very important? Preventive health. After getting the disease, not curing one, you have to prevent it. Get regular checkups, not just when something hurts you, like BP, all the thyroid problems, general examination, pap smears, mammogram, DEXA. Control your sugar, BP, and cholesterol. Strengthen your bones with calcium, vitamin D, and weight bearing exercise. This many of us, even though we doctors, we don't take regularly either calcium or we do regular exercises. But of course, nowadays, maybe this forum is making us to do all those things. And practice yoga or morning walk, 10,000 steps, because we have all the gadgets we'll be seeing. And it is 10,000 steps gain is more than 10,000 worries. And don't forget about the vaccinations, what we have to take. And take care of your mind. That's very, very important. Mind is such a thing, no, always wanders. If you want to do something, it will go somewhere, and then the speed of this, no, you cannot control. And practice mindfulness or meditation. Even 5 minutes a day can help. Mindfulness means this is very difficult to get it, means you cannot concentrate, but still for some time just close your eyes and sit in a room calmly. Everything will come and go, don't bother about it, just sit. And after some time, after so many years, you will get some feeling of happiness, some mental peace. And stay mentally active. That's very important. Read, solve puzzles, learn new recipes or language. I think most of us, we were not very much aware of the computers and all, but still at a later age, after the age of 40, we started learning all these things. Yeah, Jay, we are all very great. Talk to a friend instead of bottling up stress. Therapy is not weakness, it is a wisdom. Grooming is self-respect, not vanity. We can get ready very well and we can wear lipsticks and makes you feel good. And trim your nails, wear the nail polish and all. Whatever dress it suits you, which you are comfortable, sari, kurta, but use for onlookers, you must look very, very graceful, very good. That is the idea background of all these things. And this part, you should never forget, stay financially independent. This is what I tell even to my servants at home also. Whatever money you get, keep it in your bank on your name and put it in the safety like FDs and all. Don't usually, when they invest in local areas and all, we don't know they may lose it. Instead of that, the what is very good is start saving in the bank where you get a fixed amount of money and learn digital banking, UPI, net banking. Plan your financial security, health insurance, and basic right. This is very important. Don't depend on apne beti, bahu, anything like that. Our bank account is ours and you have it in a individual name. That's still more important. And to have a legacy, always better not to give any difficulty for the other in case of something happens. Always nominate to the daughter or your daughter-in-law, son, whoever it is, then only it will be good. And set boundaries, not just see. We are all used to share, just set the dishes, but we should know set the boundaries. It's okay to say no to unreasonable demands, even from the family. Usually what happens, we would like to go out for walking or anything. But every time any vendor that comes home, milk or something, they call it as amma only, but not appa or anything like that. So you break that. Go for walk. Don't depend on them. Let the others also share your work. So you should know how to delegate the work. And because you are not a robot, everything you can't do by yourself, because you should have some me time, save time and energy for your own dreams, not just for everybody else's work. This what I teach every day to my people round about, and find joy in the small things like music, laughter, Doordarshan serials, and hot cup of chai that itself is great. Go sit alone and enjoy. Spend time with younger women or children. Their energy is infectious. Travel when you can. Even a nearby temple town can feel like a vacation. Nurture your mental and emotional well-being. Don't bottle up. Share with friends or a counselor. Engage learning new skills, bhajans, groups, and all, and book clubs, social circles. Let us go of guilt. Taking time for yourself is not selfish, it is self respect. Try mindfulness and chanting 10 minutes a piece. It gives hours of strength. Advice regarding symptoms. Until now, it is a general advice what I have given to them, and now because they suffer with hot flushes, what am I going to do? Tell them hot flushes, unless they are very severe, there is no need to go for any medication. Simple non-medical things also we can do, like temperature change if it is present, wear the clothes in layer, use cotton things, and don't use sunscreen, keep yourself little fresh, and do some exercises, walking, paced breathing, that is take a deep breath for 4 seconds, then expire it for 7 seconds, hold it for 7 seconds, and expirate for 8 seconds. And paired muscle relaxation. And next important thing is maintain a healthy weight. That's what is very necessary. When I'm talking about the vasomotor symptoms like hot flushes, we should ask everybody who comes to our clinic to fill up this MRS scale to see where they stand right now, and after our advice or counseling, whether they are improving or not, and whether is it necessary to drink them. If the drinks this, we will know. These are all the things. I think I'll not go into details. Only thing is, accordingly, we'll ask them to mark. It is a self-declared form. If the when mark goes above 14 number, then she needs treatment. Otherwise, we can go with the lifestyle changes. And this is very important: health and well-being, physical health, mental health, social health, sexual health, community health, and economic well-being. All is possible lifestyle modification. I'll just go into little detail about the lifestyle modification. But any ordinary woman, she comes, we should tell about the red flags in the health. First and foremost is the postmenopausal bleeding. Many a times what postmenopausal patient does is, oh, it is very light spotting, nothing to worry about it. She'll carry on like that until she bleeds a lot. So inform them. It may not be a cancer, but many of the uterine cancers, they present in the postmenopausal bleeding. That's why a little spotting also after the menopause, that is, after 12 months of cessation of periods, even little spotting also, you go and take advice from your doctor. The general trend of many of the ordinary women is once they attain menopause, they think there is no need for visiting the gynecologist. Any problem, either you take UTI, joint pains, or body pains, or knee joint pains, whatever it is, they go either to the orthopedic surgeon or to the general practitioners or for anybody, not to the gynecologist. And so we should give an indicate to, you should educate even the general practitioner that these are all the problems we will tackle, not the other branches. And second most thing is the chest pain or pressure. Red flag: pain, heaviness, or discomfort in the chest, jaw, or arm. There are maybe an indication for the myocardial infarction, because the heart attack or myocardial insufficiency will become double once they attain menopause because of the estrogen deficiency. Never think that myocardial infarction, it affects only men. So ladies also should be very careful, because the statistic shows death because of the cardiovascular problems are more after menopause and than the men. And sudden wound pain or fracture, it can be there. So it is reversible condition. We have so many drugs, we should inform them. They should go and meet the doctor. Severe mood changes, persistent depression, anxiety, or panic attacks or suicidal attacks can be present, so needs treatment. And unexplained weight loss, again, this is very important. Losing or gaining more than 5 kg weight without change in diet or lifestyle, it matters because it can be thyroid dysfunction, diabetes, cancer, or heart failure. So we should tell them to meet the gynecologist or concerned physician. Next important thing, the urinary symptoms and pain or blood in the urine. Urinary symptoms, I'll swear, nobody comes to us because they think that it is the purview of the urologist or to the general physician. Once they go there, they don't examine, and most of them, they don't have an idea. It may be because of the vaginal atrophy, and urethra also has got the estrogen receptors. That's where they get it. They will go on treating with the antibiotics, and the antibiotics, patient becomes very restless because of the antibiotics. Actually, it is not a urinary symptom at all. If you ask, you take a complete history, they say it's not pain abdomen. It is when she passes the last drop of urine which falls on the urethra or onto the perineum, it gets burning sensation. There can be itching or burning, and urinary burning of the urine, they call it. They take it for granted and they complain like that. So actually what they need is the estrogen cream. With that, they will become all right within a week or 10 days. And cognitive changes, yes, just now I told you how memory loss will be present for the recent acts. That's the brain fog, and confusion or inability to perform routine tasks present. But they are all temporary. Once you stabilize yourself and make an attempt to do the exercise and all, it will be all right. Or it can be early signs of dementia or vitamin B12 deficiency. And most of our Indian women have got the vitamin D deficiency. So we should see whether she is anemic, vitamin D deficiency, folic acid deficiency, or for the B12 deficiency. And next important thing is, if there is any digestive problems that are present, yes, she should present. Many a times we miss early diagnosis of ovarian cancer is because we treat it as a hyperacidity and go on giving the antacids. So Any swallowing difficulty, heartburn, changes in the bowel habits, or blood in the stool, it can be gastrointestinal cancers, reflect or colorectal issues, or anemia or ovarian cancer. Colorectal, always, we miss it because that is the first culprit, but the most of the morbidity is because of the colorectal cancer. It is not only for men, it affects women also because of our eating unhealthy food. This has become interest. And persistent vaginal dryness, discharge, and pain. Yeah, you should remember this because many a time dyspareunia is a major problem which they don't come to us and they're shy. They feel shy to inform. That is why they will be away from the sex from the time of 40 years at least. By the time we see them at about 60 years, vagina is shrunken and we cannot even put one finger into them. That is why the early treatment, positive questioning from our side is more important than they themselves. They will never come out. So that's very important. It is because of the estrogen deficiency, and it is purely reversible condition. But if it is late, we cannot do early. If you find out, you give the estriol cream, they will reverse back. And sometimes it can be infection. So examination of the patient is very important, especially speculum examination, taking the spear scissor. Next is the visual disturbances and severe headaches. Maybe we'll forget. These are the indications for the high blood pressure, strokes, retinal issues, or brain tumor. So these are all the red flags we should remember. Next important thing is eat smart and eat local. Stick to simple home-cooked Indian meals. Add more millets, greens, dals. Cut down sugar and deep fried things. Your joints will thank you if it is there. Hydrate with buttermilk, coconut water, and plain cold water. Skip soda and energy drinks. So many a times what they ask is what I should avoid. You tell them very clearly, don't eat outside food. That is the first and foremost. And reduce your caffeine and tea, coffee. Don't say that you stop it. They don't come back to you. Processed food, they should stop it. Limit saturated and trans fat is also very good. Important to eat is colored vegetables, fatty fish, which has got the omega-3 fatty acids, which is heart friendly, mood friendly, and brain function also will be good. Keep blood pressure levels with fatty food. This omega-3 fatty acid is a good source of vitamin D and heart friendly also. And of course, proteins, don't forget. And one more thing is the cooling foods. Hot flushes, so-called cooling foods, that is apples, bananas, spinach, broccoli, eggs, green tea may have cooling down effects. And that's why they take Chinese, they take more. All these foods are rich in nutrients and disease-fighting chemicals because they have got the antioxidants. Water is really important and keeps many of the diseases away. And next important thing is the figure management. What is this figure management? Always, once you attain perimenopause or menopause, you're bound to increase the weight, not necessary because we don't do exercises, and start eating more and less exercise, we will increase. But how to reduce it? If you're a sedentary person, the calories what you need is to reduce weight 1,200 to 1,500 calories, but to maintain at least it is 1,800 to 2,000. That is what is very, very essential. Otherwise, we eat biryani, added to that, we eat ice cream and then snacks, so many things once you go for the dinner. So that we should cut short. And that is also the lightly active or moderately active. It all depends how you are going to take the calories. I mean, for my patient who is 30 BMI, if she takes about 1,200 to 1,500 calories, it is good. And to prioritize proteins because they need muscle strength. Osteosarcopenia is the one which is affecting in the aging person. So ask them to take eggs, dal, curd, tofu. Together all, they lower estrogen-related inflammation. They help to manage weight without rigid dieting, improves mood, cognition. So these are all the obesity measurements. Brain fog, I already told you. But this occurs during menopause, but it is partly true. Occasionally, forgetfulness is common. You reassure them that you are going to become normal. How to get back our memory? Usually it happens to us also. What we should try to remember what happened yesterday, details of conversation, what your friend told last week, try to remember the names, call everybody by name. Then that's a very good habit. And how you remember also. And remember the birthdays, marriage days, give greetings relevant to be the festivals. When you remember this festival, I went there, Ekadasi, I did, referring with cell phone. These are all the things. Don't refer the cell phone. Without that itself, we try to remember the things. So beauty is beyond the skin. The simple skincare, natural remedies, and hydration can work wonders. Just for yourself, this is very important. Sexual health, itching, burning. I told you already. These are all the things we should do. Most of the times, people they try to avoid going out because of the incontinence, a dribbling that will be present, stress incontinence, and how to do it. It is the Kegel's exercise. Actually, when they deliver, we need to tell them. If you forget, at least now you make them learn these things. How to do Kegels also is very important. We should teach them putting two fingers in the lying down position, ask her to squeeze the muscles. That is the correct way of doing. 3 sets for 3 times a day. If you do it, definitely it will get back. Don't think a person who delivers by cesarean section will not get the dribbling. Yes, they too will get it. That's why they need to, because of the relaxation, estrogen deficiency, their muscles, tendon, and all the ligaments will become loose. That is why they get the stress incontinence. And of course, sleeping well is very important. Sleep hygiene, we should explain the patient what is sleep hygiene. Sleep at the same time, get up early and do yoga, and mindfulness is very important. And while sleeping, don't see the screen. Many of them are very used to see the screen while sleeping. Me too, of course. I had to stop it. See this thing, and then eat very early by 7 o'clock itself. At least 2 or 3 hours gap before sleeping, so that you will get a good sleep. And one more thing is, if there is any difficulty in sleeping, put nutmeg in the milk what you drink. This gives a little sedative effect also, good for health. Or kumkum puvu, we call saffron. That also, if you add that, you say very good sleep to the tip. And next, what we should teach them is osteosarcopenia. We always will forget about this. Always we talk about the osteoporosis, we tell them take calcium, this thing, that thing, do that exercise and all. But we will never teach them about the sarcopenia. What is sarcopenia? It is a progressive and generalized skeletal muscle disorder that is associated with increased likelihood of adverse outcome, including falls, fracture, physical disability, and mortality. It contributes to frailty. This is the here I'd like to touch upon little more, because this is the place where we need to tell them. How to identify also is very important. Is what is the score score. SARCF score is there. That is the strength, how much is there. Assistance in walking, is it necessary for you? Can you, how much difficulty do you have lifting the weight? Or how much difficulty do you have walking across the room? Well, you give 0.012 and raise from the chair. If there are no arms, it will be good. How many times in 15 seconds you can get up and sit? or how much difficulty will you have that. And climbing the stairs is very important, not about 20 or 30. It is only 10 flights. If you stair, how much time it takes without difficulty or without breathing problem will you be able to climb. And falls, how many falls you had in a year? 2, 3 or 4, depending upon that the score will be there. Score equal to 4 or more is predictive of sarcopenia and poor outcomes will be present. I told you, because of the osteosarcopenia, the major thing that happens is the fall. And because of the osteoporosis, for many people, men or women, they get the fractures. So preventing the falls is very important, indoor or outdoor. Use a walker if you are old. Many refuse to take walker because thinking that others will feel that they are old. Even if that also, the pace of walking will be slow, definitely others will recognize. Wherever it is necessary, you should use the gadgets that are available, make your living very comfortable. Rubber sole shoes are very important. And one more thing is, don't walk in the rain or wherever water is there. You are likely to slip. And be careful of highly polished floors. And when ordinary floors, we call it as a kadapa stones, which is little rough. So there, the rough stones are always better. And better not to have carpets, because the ragged carpets, a little rise in that level, is likely to fall. Especially the falls, whenever you go for any CMEs where they cover up and downs with the carpet, we don't even know, and we'll fall down many times. I've seen people having the fractures. And fall prevention indoor also is very important, especially in the bathroom. Don't stand and take bath, or you are wearing the pants, don't stand, sit and do it. And especially use the grab bars wherever it is necessary. All women, we are in the habit, suppose if something, I will put a stool and then get it. For God's sake, don't do it. And try for somebody else will come and help you. That is the one. So many falls have occurred, for so many fractures have occurred. And keep a flashlight with batteries, especially bedside. And if using a step stool, I told you it's very difficult. And consider purchasing a cordless phone so that you don't have to run to use the phone. Or sometimes now the remote bells or calling machines are available. You can use that also. Now we should teach her how to judge yourself that you are fit. Because you have all the theory, if you tell, they are not happy. We should tell them how to judge themselves whether they are fit or not. One, getting up on the chair, I told you how many times she can do in 15 seconds. It is one of the strongest indication to say your body is aging well. Actually, reverse aging, if they can get up and think. This single movement involves legs, balance, coordination of body and mind. Lower body is quite strong to support you. It is not about the strength, but it is about the independence. Walk at brisk pace without getting winded. You tell them, do this. Then it shows your cardiovascular system, lung capacity, balance, muscles are working efficiently. And for that, she don't need to go anywhere else. Purpose in the house itself. Go and bring the milk, vegetables, and send the granddaughter to school and pluck the flowers for God. So while doing the household work itself, we can do it. If you need to rest in between, you need to go for checkup. Can you walk 100 or 200 feet? Yes, that shows that you have got a good resilience and you're feeling, your systems are doing good. And third is balancing. This is a really thing which you should think. Many times we want to do something, we'll slip and we'll fall down, we'll want something. That is why balance. This is again, if you learn, you can reverse it also, the balancing. capacity. Stand on one feet without wobbling. Looks like a child play, but if the balance coordination between body and mind, it says grab bars is it prevents falls, but practical standing and on one foot, if you learn, it is good. And second is get down on floor and means sit down on the floor. Previous days, when all our grandmothers and all, they used to sit on the floor and eat. That's a very good habit, but we forgot that we are not doing. But it is very good, like doing Surya Namaskar and it tells it's a total body health. It is not just about the strength, but how your systems are working together with the brain as a central point, how it is working. Flexibility is very important. And see whether you can carry grocery bags, coordination of muscles, joints, grip to carry strength, stability, it shows. As we age, muscle mass declines in arms and back shoulder. If you do this exercise, you are not only strong but functional. Squeezing tennis balls, dumbbells, these are all the things which are very, very important. I told you again, climbing of the stairs is very important. Again, it shows it is the leg muscles that are very strong. And walk up refreshed, clear headed every day means sleep well. Snoring at old age is common, more so with obesity. As the ages, tongue falls back and hypoxia, that's why they get up so many times at morning, they are not very fresh. It so happens. So don't feel upset for that. You can have the CPAP. Now, everywhere it is available. Go and take, consult the doctor, take the sleep app. And if sleeping well, immunity rises and you will not get into any problems. And teach them what is the sleep hygiene. Means I already told you. And if they sleep well, hormones are balanced. Okay. Recently we had International Yoga Day. And millions of people who did yoga on 21st June only. And next day, Thailand declared International Massage Day. And what about the relationships? Define, not resign. Very difficult to find and get the relationships, relationship with the spouse, friends, siblings, connect with the children, let go toxic ties. Peace is a priority. जिंदगी के इस पड़ाव पर सुख सबसे बड़ी कमाई है. For me, it is little difficult Hindi, but all of you are Hindi speaking. I made an attempt to write something in Hindi.
It's very nice, ma'am.
Of course, with knowing the meaning only, I wrote. कहानी सुनाओ सबको, and इसी का कहानी रोशनी बन जाता है for the next generation. And spiritual strength is very, very essential. Inner power, prayer, seva, satsang, and just keep in silence. Find your anchor. Aging is spiritual ripening. Tune into your deeper self. Holistic approach for happiness is positive thinking, forgive and forget, no ego, no greediness, strong social support, finance, me time, self-confidence. Finally, it is roti kapda, makan. You should have all these things ready for your old age. Positive thinking, this is the thing. Always do not go on criticizing or complaining. It leads to a sick mind. It's okay if you have a bad day. It's okay if you make mistakes or performance is less. Then you say it's okay. That is why grandchildren always come to us. They don't go to parents if they get less marks, because we have developed that attitude. Let it go. And we tell them, okay, next time you will get it. Don't worry about it. And put ourselves first. That also self-care is very, very important. So positive thinking is very important. Forgive and forget. This is the one. We don't have the grudge. some time back you fought with somebody or you had bad memories. Now you try to forget. So greet them every day morning. So you'll be a peace of mind will be present for you. And ego, don't feel very high of yourself. Many people occupying very high positions like directors and all, they continue that in the later stage also. No, nobody will question you what you are. You are only how your behavior with others. 95% of the problems in life are due to the tone of your voice. It is not what we say, it is how we say. Just change the tone and see the change in life. That's what is very important with everybody in life. You can get the things done with a good tone and good voice and strong social support. How do you get it? You don't need to social support princess run, go and do something like that. It is eating meals with loved ones, with family, friends, or going out with and friends, taking a road trip, all these things. Then enjoying with old friends, especially with the schoolmates, college mates, or high school students and all, you enjoy with them. Don't worry about getting old. Worry about thinking old. This is what is very important. Live in an Indian way. Gather yourself in small pujas, what we celebrate. Satyanarayana Puja, Batakamma we do in Telangana. This one way you all get together and share your thoughts, what is happening, and age appropriate dressing adds grace to the looks. Play with the children. That's what is very important. And you will enjoy, and your mind will be very fresh. Give uh, cautious aging to try and be with your grandchildren. And that's what is the olden days now because of the nuclear families. This habit gone itself, but I feel it is coming back. Laugh. This is what we do every day in Indira Park. We go there. There is definitely 1 minute walking session, laughing session for all will laugh so loudly, everybody will look at us. Laugh, lowers stress levels, crucial for healthy aging. Smile, laughter is timeless, wrinkleless, and life is with medals, it will be present. And a little more about the brain fog. Already I told you how to get rid of it is relevant to the festivals. I told you how to get. And stress management is very, very important. And laugh is the best medicine to relieve the stress. And this is one story of a in Kerala old woman. She topped literacy exams and now she's learning in computers. This is a 90 years old lady enjoying reading with a glass with the enlarged with lens that is there. She's learning. That is what is the inner feeling we should get it and learn the new things. And social service is very important. Food feeding, going out, destitute homes, whatever money you have, don't store it for your generations to come. Try a part of it, give as a donation, blood donations if it is possible. Of course, for senior citizens, they don't take first of all, but write down your eyes donation after your death or body donation to the anatomy department. They are very important. No need to save for the coming generations. This is one time that's important in the me time. Time to individual, everybody should have a new time like music, veena, games, computer. This you see, this is one of our conferences. All of us, we danced. I think all of you can see Dr. Chawla here.
Yes, yes.
Madam, Hemlata madam, she is 80 plus that time. Everybody there, she was they were dancing. And this is me and my husband at his 70th birthday, enjoying with all our family friends. So, but still, one thing what we should understand is why so many women are unhappy even after 50 years. All women are not the same mindset. Ours is a secular country. what Indian women love for is it is the love and affection from the family, children, and all. We are not like Westerners, take diverse, live independently. We don't want to have any ties, family bonds. But that's why we should make up their mind, and how to live peacefully at all ages is very important. At all ages is very important. I think it is a bell for me. Give me 2 more minutes to complete. Recent evidence-based guidelines for happy living is NAMS 2024 endorses lifestyle interventions as first line for mild to moderate symptoms, especially when hormone therapy is contraindicated. The same is endorsed by the International Menopause Society that the digital health tools, group education, and peer support systems for better compliance. What are the new trends and old trends? I tell you. Previously, the same things were there. Like, diet means low fat, calcium rich, but now it is the Mediterranean and anti-inflammatory diet. They are telling what is this anti-inflammatory diet. All are highly relevant. That is restricted eating, time restricted eating, inflammatory nutrition, and Mediterranean diet, anti-inflammatory nutrition, evidence-based strategies for lifestyle management. This is what is the Mediterranean diet, high in olive oil, vegetables, fruits, whole grains, nuts, fatty fish, moderate in dairy, and low in processed food. What is the alternative for the Indianized food that you know? Whole wheat, barley, leafy greens, apples, berries. These are the things which we use it. Almonds, walnut, cashew nuts, peanuts, all things that are available for us, very good. Anti-inflammatory, we use it daily, but we don't tell. Flax seeds, green leaves, turmeric, lot many things what we use every day. There are very good anti-inflammatory drugs. That is omega-3 fatty acids are there in that, in all the spices like turmeric, ginger, and garlic, colored fruits. They are all anti-inflammatory and protects us from the immune affected, the non-communicable diseases that are there. This is the one which we know it is the old wine in the new bottle. What we do regularly as the Ekadasi, once in 15 days, or give in the God's name, we start for half day. Either Sai Baba or, for us it is the Venkateshwara Swami, Raghavendra Swami. We start once or twice a day. That's very good. A common means eating for 8 to 10 hours and then fasting for 16 hours. There are so many patterns are there. That is the time restricted eating, fasting for 16 hours, 12 hours. Like, what is the benefit of doing this is it improves insulin sensitivity and metabolism, supports weight loss, and enhances sleep and reduces nighttime symptoms, regulates hormones and energy levels. So, fasting is very good. The secret of living well and long is eat half, walk double, laugh triple, and love without any measure. The next important thing is previously we are telling walking and aerobics, but now it is a strength training and functional fitness. What is this aging is, what is this functional fitness? This improves real life movements, balancing, I already told you, whole body movements, coordination, prevent falls, and enhances independence. This is what using the dumbbells. If dumbbells are not there, take the water bottle, 1 liter or 2 liter bottles, and lift them, and doing the belts, using the belts. If it is not there, pallu, what is there, with that we can use it. We can do the squats, and we should learn how to stand straight and do the lunge exercises. What is this lunge? Is a body resistant exercise that works the leg muscle. This is very important. What happens after 70 years, we feel difficulty in getting up because the leg strength is not there in the leg muscles. That's why we should focus on major muscle groups, legs, back, arms, and all. And 2 to 3 sessions per week, ideally non-consecutive days. If you do it, it will be good. And functional fitness, again carrying the bats getting up from the bed, and steps rising and sitting. And yoga, meditation, and I think all of you must be knowing about the Tadasana, Trikonasana. Little difficult to do it, but not so bad. Once you learn for about a month or so, do it. And one more thing, what you should remember is just thinking that you have learned, you are going to do it. Definitely not. It is the company that is very important. Social, we are all social beings. Go to a park, sit along with them. About 50 people are there. They are so happy in doing Surya Namaskar and all. That gives a refreshed ideas. And bonuses include pelvic floor exercises, often neglected but critical in menopause. Many a times we teach them, but we don't know how to tell you. Put your fingers, ask her to squeeze her muscle, then you will know whether doing a proper exercise or not. That is the Kegel's exercises. We should teach them. The next comes is the mind body. That is the cognitive behavior therapy. Means it is the reframes negative thinking about menopause, sleep, and body things. Now it is recommended by NAMS and NICE as first line therapy for vasomotor symptoms. Mindfulness, I told you, it is just sit calm like that. That itself is the mindfulness. Routinely at home also we do. Means we'll concentrate on some doing. That itself is a mindfulness, and it reduces perceived stress, cortisol levels, helps manage mood swings, irritability, and brain fog, enhances emotional resilience. This one thing really is helping us. It is the personalized lifestyle management. We are having the Fitbit and Aura, that is the ring that is there, watches. Of course, we do use every day to count the steps, how many kilometers we walk, what is the speed, what is the heart rate, activity levels, body temperature, and all that indicates. Features what we have seen that women love is daily reminders for hydration, breathing, mood diaries and symptom graphs, community chart rooms with peer support, and personalized tips. That is there. So finally, see Raj Kapoor how he's enjoying his life. Hum Dono picture, I think this is very old picture.
Very nice.
No sound in the video, ma'am.
Finally, who is shaking the world? Within 72 years, and Kamini is 85 years. But we are thinking that after 60, everything is over. These people are shaking the world. Wake up, senior citizens, wake up, and we can do anything in the world. To conclude, you are not aging, you are becoming more you. Midlife can be your prime with health, joy, confidence, and care. Triple R, don't forget, right food, right examination, and right thinking. Thank you, everybody.